Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Sarah Clark, fertility coach, speaking on how to get pregnant naturally. When Sarah was 28 years old, she received a diagnosis of premature ovarian failure. She accepted the diagnosis and had both of her children through in vitro fertilization. Years later, she realized the root cause of her infertility was a food sensitivity and later a gut infection. She is a certified life coach with accreditation from the International Coaches Federation and a health coach with training from the Institute for Integrative Nutrition. She is the author of Fabulously Fertile, Supercharge Fertility Naturally. Her fertility coaching program, which includes functional lab testing, supports couples to make diet and lifestyle changes that dramatically improves the chances of healthy pregnancy and baby. On her Get Pregnant Naturally podcast, she shares that with functional medicine and natural fertility solutions, we can eventually reverse infertility. Check it out on iTunes and Spotify. And don't forget to check me out on Facebook and Instagram at Brayton Birth Method. Hi, Sarah. Welcome to the show. I'm so excited to have you on today.
Thanks for having me, Laura.
Yes. So this is going to be great. We're going to talk about fertility and getting pregnant naturally. And this is something that I know is very near and dear to your heart. So if we could just start off with sharing your story of why you chose to become a fertility coach.
Yeah, being a fertility coach was definitely never on my life plan, but I was having, and so my early 20s, I had irregular periods. My cycle was coming a couple times a year. I thought at that point that was a good thing. I had this weird fungal rash on my chest. I had acne on my chin when before I had great skin in my teens, and then then I also had some yeast infections. So at that point I was put on birth control. Obviously that was sort of a Band-Aid approach, didn't get to the underlying cause of why those things were happening. And then I had this life plan of getting married at 25 and having my kids at 28. So got married at 25, and then at 28 but just before that decided to come off the pill, and my periods were still irregular. So then I went to see my OBGYN and had some testing done, and I was told I had premature ovarian failure, or premature ovarian insufficiency as it's called now. And I was told my only option for having children was to use donor eggs. I remember her reaching up and grabbing the IVF brochure, and I was in shock, obviously, because I'm a person of action. I left the clinic, left her office there, and went on a list for donor eggs.
Wow! And immediately.
Yeah, immediately. I didn't take any time to grieve. I didn't get a second opinion.
Right.
Didn't even. It's like insane when you look back at it. And didn't think any of those other health issues that were going on were related to anything. I went to the clinic. Back then you'd get the donor profile by mail. I waited by the mailbox for the profile. We selected the second one that came through, and we're lucky enough on the first fresh transfer to have our daughter, and she's 18. So this is back in the day when you said donor eggs, people looked at you with a blank stare.
Right.
I still think it's not obviously as common, but I think more people now have heard of donor eggs, and we got all these, embryo adoptions and embryo donation because of all the IVF procedures that are going on. So, and then we had 2 embryos left over after my daughter, wanted to have our kids close together. So went back into the clinic, and I was very keyed up to have them close together and stressed out. My husband's like, hang on. And I'm like, no, we're going. And unfortunately, those 2 didn't work. Oh. So then we went on a separate list for a separate donor egg, same procedure with it coming in the mailbox, and lucky enough on the first fresh transfer to have our son. So he's 15. So it's really, and then after I had my daughter, my health took a nosedive. I remember having 9 colds in 1 year. Every cold went into a sinus infection. I thought it was a great idea to take antibiotics for every sinus infection. Not a great idea. I destroyed my gut flora. Then I started getting chronic bladder infections. Again, I took multiple antibiotics for those, became allergic to all the antibiotics. The yeast infections became chronic. I was still doing my thing. I was still in corporate doing my thing, but my immune system was just compromised and low. So I had vertigo and toenail infections and dandruff and seasonal allergies, and was allergic to all these antibiotics. And then I decided I was in HR. I wanted to bring life coaching into the corporate environment. So I took a life coaching course, and that's when I had my own personal wake up call. Decided I wanted to do health and wellness, took a health coaching course, and that's when I discovered I had these food sensitivities. So for me, sensitive to gluten and dairy. Later, I found out corn, took out corn as well, and then lo and behold, the bladder infections, the sinus infections started to dissipate. A few years after that, I discovered I actually had gut infections, so H. pylori and streptococcus and fungal infections. So worked on that, then worked on the lifestyle factors, but I didn't discover any of this until I was 40. So I was fully in menopause. And so that's why I really want to spread the word. I have my podcast, Get Pregnant Naturally, where talking about natural things you can do as long as you're still cycling to restore and reverse infertility, because really taking a functional approach to this, there's things you can do. And a lot of times, I was fortunate, but a lot of times the first recommendation is off you go to the fertility clinic.
Wow. So I know you said you were studying to become a health coach, but did you also work with a health coach just to get some guidance about your own, like what supplements to take and things like that in the beginning of your journey, since it was new to you and it's hard to actually treat yourself?
Oh yeah. Yeah. So I went through a number of different naturopaths, and then it's not until I discovered a functional nutritionist that things started to improve for me.
Oh, wow. So even the naturopaths weren't getting all the way to the root cause.
No, it was like digging into like the first step of like attacking candida and fungus, and like there was recommendations for food, so I was able to make those changes. Not until I really got into the gut infections that I addressed there, and then also looking at all those basics like sleep and overdoing things and stress and all of that. So, and that's then I ended up writing a book on fertility, Fabulously Fertile, and then it's kind of the whole fertility coach thing came to be. And as I say, I'm a planner, and that was never on my life plan.
Well, God brought it into your life, and it's interesting because for some people it might have been like you were trying to get pregnant and were unsuccessful, and then found that route. But you actually found it after you had your two children.
Yep. Mm-hmm. Yep.
Very cool. But I can see, like, from your history, you're having that personal story of wanting to heal your body and wanting to become a mother, and really having health and vitality, because beyond fertility challenges, it sounds like there were also other health issues going on. It's all connected.
Absolutely. Yeah. It's not just like, for me, the tipping point, and it showed up for me, was premature ovarian failure. So infertility, other people, it shows up as diabetes, heart disease. It's different for everyone. So the people that I'm working with, it's infertility is kind of the tipping point, and pushing ahead and pumping yourself full of drugs. Some people are obviously successful going that way, but I see people that aren't.
Yeah, definitely. And the IVF route does have the side effects, right, with the medications and the hormones and things like that.
That's right.
So, so for women listening on today who are wanting to get pregnant, ideally naturally, without having to go the IVF route, what are some things that you can recommend that are going to help enhance their fertility?
Yeah, so we take a functional approach. We look at functional lab testing, but basically we first start people off by doing an elimination diet, because most people that come to see us, they're like, I eat a clean diet. They may have kind of dabbled around with some of the inflammatory foods, but they haven't really been strict about it. So the elimination diet is the gold standard to really figure out, do you have a food sensitivity? And so that's taking out dairy, gluten, corn, soy, peanuts, and eggs, and processed sugar for 10 days, and then systematically reintroduce it. So we typically will deal with female factor infertility, but we're coaching couples. So it's to have both partners make those fundamental diet changes by starting the elimination diet. Mm-hmm. And then you're reintroducing it over the course of 30 days. And most people have some sort of symptoms if they bring back in dairy or bring back in gluten. They could have digestive issues. They can feel phlegmy. I've had people with corn they bring back in, and it brings on asthma. So it's different for everyone, because you can go and get a food sensitivity test that can come back that you're intolerant to all your favorite foods, but are you really going to then connect the dots and see how that makes you feel? So the elimination diet really helps to target how food impacts your body in a very customized way.
Mm-hmm.
And then we have people do food sensitivity testing. And depending on where they're located, we have access to different lab tests. So we either do an IgG test, so delayed. So the bread you have on Friday, you don't notice the fact that it's giving you a headache on Monday. We also have access to the LEAP MRT, so that looks at 200 foods and food chemicals. And one that we really like we've been using the last 6 months to a year is Vibrant Wellness, which is a Zoomer panel. Because a lot of times people that we're working with have had repeat miscarriage. They're either endometriosis or premature ovarian failure, premature ovarian insufficiency, low AMH, unexplained. And we're finding that there's a high sensitivity to gluten. So not necessarily celiac, and the current conventional celiac test will only test for one. I think it's 1 to 4 proteins in gluten, whereas the Zoomer will look for about 26. So with the current celiac model, there's a lot of false negatives, and we're seeing people have non-celiac gluten sensitivity. So high sensitivity to gluten, and important for the whole household to go gluten free. So that Zoomer. So that Vibrant Wellness, they have Zoomer, a beet Zoomer, a soy Zoomer, a corn Zoomer, and a dairy Zoomer, plus the IgG. It just really digs into the minutia of food, but then after that, you've got to start making the changes. So that's kind of where we start with diet.
Right, and I appreciate how, because I see this in my office as well, where people are in general eating fairly cleanly, but to your point, they're not strictly avoiding those highly common allergenic foods, because they'll have it like on occasion, right? It's like a dabble. But if you're really wanting to get down to the root and identifying what you're reactive to, especially because there could be a delayed reaction, like you mentioned with the IgG, then you have to follow that elimination quite strictly to get the best results, and get the clearest response of what your body needs and what it doesn't need.
Yeah, absolutely. I think a lot of people, they'll be like, oh, I'm gluten free or I'm dairy free, but it's really gluten light and dairy light. And they'll be like, oh, once every couple of weeks I'll have some cake, or I'll cheat.
Right.
It's not really, because if your body has sensitivity to that could take, days, weeks, months for your body to then recover from that exposure. So It is to be, vigilant, and then seeing what it is, and potentially, like a lot of times we're seeing people that you'll need to keep out gluten long term, but most of the other foods, and potentially dairy, but most of the other foods you can bring it back in after you start to heal your gut. So it's it's that very personalized approach. But it could suck that you've got to take out some of your favorite foods, but an average IVF can take 3 cycles and it costs us $60,000. So playing around with your food here and figuring out which food is right for you is also, important for your preconception health, your postpartum health, the health of your children. It matters.
It does matter. And, it can be inconvenient sometimes, but if you're really committed to getting healthy, I think it's worth it. Meal planning and really being very, so also I think that's the other challenge sometimes when people cheat, right? It's they're starving and they haven't really prepared how to avoid those foods. So it's really does require a little bit of anticipation of, going to the grocery store, which is a little harder right now, getting the foods that are non-inflammatory and having recipes and things ready to go so that you're well fed and avoiding those allergenic foods.
Absolutely. Yeah. I was kind of a person like last minute running out the door, and now I make sure that I make sure I bring my lunches if I have to go somewhere, or there's just a little bit of preparation, but it's really not that much.
Right.
Just because you don't want to get to that hangry thing where you're like,
correct. You don't want to be desperate and I can't even think because my blood sugar's so low. Exactly. You're like, no, I got this handled. I got my little snack that I know is healthy for me, or I pack my meal, my breakfast, lunch, dinner, whatever it is. It's definitely worth it. And it is interesting, what you're speaking to, and this is something that has become more eye-opening for me because recently with my 2.5-year-old son, we had to take dairy and gluten out of his diet because it was creating issues with potty training. And it's fascinating how food sensitivities can, like you mentioned earlier, can impact us in so many ways. But regardless, if you're eating, and he was, I would say dairy and gluten, especially gluten light, but we weren't strict. And one day he was just consuming all of this yogurt and cheese, and it was all organic. But I saw this crazy tantrum and this behavior that I was like, whoa, who is this child? And I was like, it's got to be the milk. So we took that out, but the potty training challenges were continuing. And then now just this week, we're like gluten free. And that also, because he wants to eat everything I'm eating, it is now our whole household. And we were gluten light, but now we're really gluten free. Like I literally sent all of that food that had gluten in it. I had to send it to my husband's office just to like get it out of the house, and my husband can eat it when he's at work. But it's really it is like the whole family is on board with this now, because we have to reduce this inflammatory load on his body. And believe it or not, there are some gut infections that we're addressing. And so this is even in a young child. I think it's important to recognize that there can be, this is not just even impacting fertility or adults, but this can be something that impacts men and children and all types of people. And this is somebody, my son, I was like, he's healthy, right? But like when we try to get the potty training going, that was our red flag. So red flags will present for people in different ways, but it's really exciting to get this inflammation down within his body so his nervous system can function normally. And that's what we're really needing to happen here, right?
Absolutely. Yeah. I think so if they've got an infertility diagnosis, and then the first next step is your OBGYN, and then you go to your reproductive endocrinologist, and then they go down the IUI and IVF route. But it's forgetting about, first of all, your health, and then that postpartum health. There's a lot of postpartum anxiety, depression, postpartum rage. I had postpartum irritability, crankiness. I don't know if it was rage, but it was certainly a cranky little person. And then the health, like you're talking about, the health of the children. So both my kids, food sensitivities, my son, asthma. So both my kids are obviously teenagers now. So yes, I've had them for probably the last 10 years, like gluten and dairy free. As a teenager, it's a nightmare. And so now dealing with some mood issues with my son and a bunch of other stuff, but not good. But being able to look at this from a functional standpoint instead of like going head on down the medication route. Not to say medication can be used at some points, but
it's the last resort, in my opinion. And once again, it's not that sometimes IVF isn't needed, but it should be after you exhaust everything else. I mean, certainly doing functional medicine and nutrition as a starting place is, to me, like very common sense. I think sometimes though, like in your case, you were mentioning you weren't even aware of these other options, right? So ideally, with informed consent in medicine, multiple options are presented to somebody who's told that they have fertility challenges. But sometimes in the medical world, it's just following the medical model and not really looking at the functional wellness model. And that's where, as consumers of our health, we have to be a little more proactive in research and find out. But there's this opportunity to really get healthier in so many ways. And that does impact, like you mentioned, even early parenthood, your ability to heal after birth, your mood, and how you relate to your family, your patients. All of these things can be connected to your health and your and especially your gut health.
Absolutely. Yeah. It's looking at the whole body, and we get focused, especially with the infertility diagnosis, just focus on that diagnosis. How do we improve egg health? How do we improve sperm health, which is fine. But what about the people who come to me? Oh, I have infertility plus, by the way, I have Hashimoto's.
Right.
It's not, oh, by the way, I have an autoimmune disease, or,
right.
Oh, by the way, I was on birth control for, 10 to 15 years. Oh, by the way, I'm in this like high stress job. I see people that are working 50, 60, 70 hours a week,
right.
High stress. So those things, it's looking at the whole body.
It's looking at all, the whole body and the mind too, right? And how it's
Absolutely.
all connected. And I know I had a guest on a few podcast episodes ago where we focused on fertility regarding men and women. And that is always something I make sure to bring up, that fertility is not a woman only job, right? Like it takes two to make a healthy baby. And so having your partner on board is cleaning up his diet and getting himself healthy is just as important.
Absolutely. Yeah. I first started doing this. I was coaching women and then realized I'm missing the whole other equation to this. So now we exclusively coach couples. There are people, if they're going through this like by themselves, we will coach singles, but basically it's couples and dealing primarily with female factor infertility, but there's always things that the male partner can do to improve his health, whether it's the diet piece that they actually do together,
right.
And the infertility too. Men and women handle it differently. Women are typically joining Instagram, Facebook groups, talking maybe to a few close friends. Men may not share this with anyone. So
right.
being able for him to give voice to this stuff, he may feel he has to be strong for her. So just having the two people, like sometimes when they're having these conversations, they haven't even said out loud some of the feelings that they're going through. And just even getting that off your chest can just help, release your shoulders and help with stress.
Yeah. Yeah, that's such a good point. It's helping them as a team connect at a deeper level emotionally, despite the current challenge that they're facing. And there obviously can be issues with the sperm as well. But even beyond, let's assume he has a really high sperm count. There's the genetics that are in the sperm, right? And there's an epigenetic factor that we can actually control what type of genes are going to be passed on to our offspring through our epigenetics, which is our lifestyle.
Yeah, I had Dr. Ben Lynch on the podcast, and he's the author of Dirty Genes and expert in MTHFR and epigenetics, and talking about he's actually found some research that's saying that infertility can be passed on. We haven't done something about this to the next generation, which that's a little bit shocking. But yeah, we're in a really powerful spot during this preconception period to focus on our body, mind, and spirit to figure out, to optimize our health. And there's never a downside to taking some time to optimize your health. And most people that come to see me though are in a panic. It doesn't matter if they're 29 or 39, like they're past the point when they want to have their child. So it's they can feel a lot of impatience, a lot of biological clock ticking, time wasted. Everyone, we've got a mindfulness group that we're running right now, and that like huge triggers for people on the fertility journey are pregnant bellies, baby showers, celebrities announcing pregnancies. Like a lot of triggers that send people down into this very dark spiral, feeling that it'll never work for them.
Right. And that's where the support, having a safe place in a community to talk about this is so important. And I think also you had mentioned, even like if the couples had repeat miscarriages, so they actually are able to get pregnant but not maintain a healthy pregnancy. That can be extremely challenging on a couple because there's now a grief component to the loss. And I've certainly seen in my office, men and women handle that, the miscarriage differently. And the body needs time. The woman's body needs time to recover from that pregnancy, right? Because there's that component as well, as opposed to like just had a miscarriage, I got to get pregnant again. But there's an opportunity really to heal and replenish your nutrient load as the vessel for a future healthy conception. And that time is really important to respect, I think. And I think it is, like you said, it's hard to be patient in a place where you've been, waiting for years and nothing's happened. And especially if you're in your late 30s, early 40s, you can feel like you don't have it, time is up. But that giving yourself time to heal and be healthy is so important.
Absolutely. It's why do we, when we, for planning a wedding, we plan the wedding for 12 to 18 months, but then for pregnancy, we want to get pregnant in the first month. Why don't we switch that around? I think people it's like looking at your body and looking at both you and your partner together and creating that solid foundation, which is hard when you're like, wait a minute, you've gone through, multiple failed IVFs, multiple failed IUIs, and you're in a very dark place and everyone around you is getting pregnant. Now we're going to say, oh, I need you to spend, the next 6 months to a year. Probably want to slap us, but it is in, like, from someone who's experienced postpartum issues, who's experienced issues with, food sensitivities and mood issues and a bunch of other stuff with their kids. It's a very short period of time in the grand scheme of things.
Yeah, it really is. So that was actually one of my next questions. So when you have a couple who come to you, and let's say regardless of the age of the woman, they're looking to go through your program and conceive a healthy baby, how many months are we looking at before they should actively start trying?
Yeah, so it's a 6-month couples coaching program. And basically during the programs, we're doing those functional tests. We do the food sensitivity test. We do the Dutch test, looking at your hormones using urine. We're looking at stool testings. We use the GI map test, looking at the DNA of your stool. And then we're also doing a hair tissue mineral analysis test. So we see a lot of people eating that nutrient-dense diet, but maybe they're not absorbing the nutrients,
right?
Especially if they've been on the pill. So depending on what we find in those tests, typically in the stool test, if there's a pathogen, if there's bacteria, a fungal infection, a parasite, we need to then address that gut infection. Typically, the protocols are anywhere from 3 to 4 months. So during that time, will be contraindicated to try.
Right.
So and not doing this alongside. It wouldn't make sense to do it alongside IVF. Some people are like, oh, I'm going to do IVF, then I'm going to do this stuff. Like, to me, if you've got an IVF plan the next month, like dig deep into the whole mindset side of things, visualize affirmations, meditation, like really visualize it working on your stress.
Chiropractic adjustments.
Pardon me?
Chiropractic adjustments.
Yeah, exactly. Exactly. Yeah. And really like dig into that piece. But if you want to take a functional approach and figure out why it's not working, then yeah, it's 6 months to a year to really, especially if there's an autoimmune disease, that takes longer. So yeah, during the protocol, there's going to be times when you wouldn't be able to try. And some people are like, oh,
right.
No, I can't do that. So it's not for everyone.
Yeah, correct. And that is a really valid point. It's not like, oh, I'm going to be doing this really, because when you're talking about like gut infections, parasites, candida, all of that, this is a deep detox, especially if it's been in your body for years. It's now on the cellular level. And and the supplements and remedies you're taking to correct that are not things you take during pregnancy. So this is really important to clean out prior to getting pregnant, and certainly not while you're actively trying, whether it's naturally or through IVF. You want to clean that out. And the one thing I also have seen, speaking of that, like, let's say you get these test results that show you have these infections and you're like, oh, well, I'll wait until after this IVF round or whatever.
Yeah.
Like you can actually pass this stuff gets into the genetics, and you can pass certainly these types of infections on to your baby.
Yeah.
So, and that includes Lyme, that's another issue I've seen come up. So it's really great to get these tests done that you were mentioning, all those functional medicine testing, find out what's going on at a very deep root cause in your body, clean it out, take those few months, however long your body needs to heal. And then you actively try. And like you said, we're talking maybe an extra few months as opposed to, to have a healthy pregnancy on the first go, as opposed to going through either expensive IVF, that's unsuccessful, or even if it is successful, perhaps it's not the quality, like the baby's not quite as healthy as they could be because you didn't take the time for you and your partner to do the work, essentially. And this is work, anything regarding getting healthy and healing your body, especially when we're talking anything that's chronic, takes time. And I think that's really important to respect and acknowledge, because sometimes in our society, we're looking for quick fixes. And in some ways, IVF is kind of a quick fix, right? And it can be, but it's not still addressing the underlying imbalance going on in the body.
Yeah, I think people, when they go, they think IVF is the only option. To me, IVF is there. It was developed for people that have tubal blockages. So now they're using it for every last infertility diagnosis. And so it's available to you, but why wouldn't you look? And I think a lot of people think they may have done some of the foundational changes, but typically what we see people missing is they haven't really dug into the diet piece. They're missing gut infections. The environmental toxins, they may have looked at their personal care and their cleaning chemicals, but have they looked at EMF exposure, which is, equally harmful for both male and female fertility? Have they really looked at filtering their water? Have they switched to organic? A lot of times people are maybe partially on the organic train. So are you 100% organic because of all the pesticides? And then also, have you dealt with trauma from either infertility in itself? Have you been through failed cycles? Have you dealt with trauma from childhood or something that may have happened to you? Have you really got honest about your stressors? Like most people that come to us they're in love, they want to have their baby, but there's a small percentage that are having issues in their relationship. So the fact if your spouse is never there and he's working 90 hours a week, when the baby comes in, what's going to happen? So having these conversations now. And then the last one is that the structural stress, like if you have a misalignment or a pinched nerve or you have scar tissue or adhesions, those can be a stressor on the body. So that is missed too. So I think people think they've done these changes. And I think the quick fix is, to me, the supplements. And I have people tell me, oh, is there a supplement for that? You can't out supplement a poor sleep, not moving, a bad diet, and stress.
Right. It's to be holistic, it's not one thing, right? It's looking at every area of your life and seeing how you can optimize health in that area. And that is true. I have a lot of women coming to my practice, like let's say they're already in their late 30s, they're very career driven, type A, and they've gotten married later. They were planning, their plan was to start a family later, right? So that was already part of the plan, and now they're there and they're like, okay, I just got married, I want to get pregnant, but they are still working these crazy hours and high stress. And then the other component, it's a little bit quieter because we're been quarantined in this area in New York City. But in general, the lifestyle of like after working a long day, going out for drinks, right? And so it's interesting too. I see this, I don't know how much you see a lot of this, but women who are like wanting to get pregnant, but are still maintaining a lifestyle of alcohol on a fairly regular basis to calm the nervous system from their high job stress. So, it's kind of counterintuitive. It's almost like, well, I'll stop drinking once I'm pregnant, but we can see how regular alcohol consumption can also certainly be an issue as well if you want to have a healthy baby.
Absolutely. Yeah. And I'm sitting here coaching type A, busy professionals, doctors, nurses, accountants, lawyers, all people that are like driven and that's why they're able to find this stuff and make the changes. Right. But sometimes, with that busy lifestyle, we do see people that are regularly drinking, one drink per day. Maybe they're still smoking marijuana. Like typically not. Like it would be more, if I had to generalize, more of the men that are still doing a drink a day.
Sure.
They may still be smoking. Most people that come to me have kind of decided, we know that like the basics, no smoking, no alcohol, no marijuana. So they kind of made those changes. But if they're coping with every day with alcohol, that it reduces the success of IVF. It impairs sperm health. So drinking, And
I was referring a lot to the women in my practice, but to your point, the man too, like if that is his lifestyle because he has this high stress job, and even though him and his partner have decided we want to have a baby, it's almost sometimes in our culture, I feel like the men are like, well, I know that she's got to change her lifestyle for pregnancy, but I don't have to change mine.
Yep. And that's why we coach couples, because it's like, why is she making all these changes? It takes two. And now infertility is 50-50 male versus women, 50%. So there's lots of things he can do. And I think a lot of the times what I find is the male partner is very supportive. He'll do whatever it takes, but I don't think he really knows what he should be doing. So he's being supportive, but there's definite steps he can take. So we will do a blood chemistry review, and it's not to diagnose, it's to educate. And we're looking at the blood chem based on functional levels. So for healthy people, as opposed to the conventional ones. So it's just flagging potential areas that have been missed. So even though his sperm health is fine, like what else is going on with his health? You see couples passing H. pylori back and forth. And then also seeing potentially with the male partner too, some food sensitivities.
Right.
And then stress. Pardon me?
Yeah. Candida.
Absolutely. Yeah, exactly. So it is to include him and then give him a plan, because I think he's ready and willing, but and you can't coach your partner. You can't, it's not about nagging him and saying, taking your supplements, doing all this stuff. Right. To me, it's lead by example. When he sees you making these changes, he'll be like, I'm on board.
Yeah. And I know you went over some of the functional tests that you do with the couples who start coaching with you. How does that differ from some of the allopathic or medical fertility testing that typically people are aware of from their OBGYN and their reproductive endocrinologist?
Yeah, so basically the test that we're running, so I'm working with a functional diagnostic nutrition practitioner. She's the one that's going to run these tests and then develop the protocol, and then I help them coach and implement all the changes. But basically, so these tests, most people haven't done these tests. They're doing, from the allopathic side of things, they're doing blood work and being told that potentially donor eggs are, their only options. They're looking at their blood chemistry and maybe we see this all the time, being told their thyroid is normal when, your TSH is normal, but they haven't looked at the full panel. Right. So a lot of things being missed in the blood chemistry, being told things are normal. And you can do the structural testing, making sure your tubes are not blocked, and doing, sperm testing, and those tests from a conventional standpoint are important. So it is important. Like, we believe in a round table approach. It's not excluding your OBGYN, your RE. You include them, plus your coach, plus nutritionist, plus your chiro, your acupuncturist, not all at once, but having them there for you, but you're in the middle, and you know your body best. So, and I think a lot of times we just go right over to the person in the white coat, and we forget about all the other things, and we forget about our own body. So it is to do those basic tests with your RE, but then, they're going to then recommend you to go off to do an IUI or an IVF or use medication. Whereas let's look at some other options as to, is your thyroid off? If you have low vitamin D levels, why are they low? The recommendation is for IVF is to supplement with melatonin. Well, that then impairs your body's ability to produce its own melatonin. We see people on the Dutch test with melatonin off the charts, and it could be an indicator of gut infections and other things if your melatonin is low. And also, we're exposed to all this blue and green light. Right. So, which making sure that you're protecting yourself, both you and your partner, from the blue and green light from your tablets and your cell phones and laptops. And then also we see, let's just say, infections going back and forth. We see blood sugar imbalances. It's just really looking at the whole body. And if you have been on birth control, that predisposes you to those gut infections, food sensitivities, and then your body's ability to absorb nutrients. We see a lot of people eating like that great healthy diet, but maybe their body's not absorbing all the nutrients. Right. So,
and birth control would include like even a hormonal IUD, any type of hormonal birth control, not just the pill.
Yeah. Mm-hmm. Yeah, and then there's like all the
havoc in your normal hormone balance.
Yeah, copper imbalances and things like that. And people, if they have amalgam fillings and mercury exposures, and it can be overwhelming. To me, it's just like to start like with the basics. Most people that come to me, their sleep is off. So if your sleep is off, that's the foundation of health. Like really look at a sleep routine, like minimizing the blue light, taking the phone out of the room or putting it on flight mode so you're not exposed to EMFs. Get a sleep mask. Looking at decluttering your room. Use it only for lovemaking and sleep. Make sure that your curtains are blocked out. If you are waking up during the night, maybe you need a little snack with fats and protein before you go to bed. Castor oil packs. Like the sleep part is key, and we see a lot of people that have got issues with sleep, and then also movement too, making sure that you're because it's a type A person that we're dealing with, we're coaching. A lot of them are training for a marathon or
Right.
running every day. And so that vigorous exercise can then not be recommended for fertility. And when we're like, okay, let's do some fertility yoga, which is typically like hatha or yin or restorative. It's like super slow.
Yeah.
People are like, I can't do it. It's too slow, which is the point to then be able to slow down.
That's right. We got to like elevate the parasympathetics and get their body out of fight or flight, right? They are not being chased by a tiger.
Yeah. Yeah. And so if you're doing some of that slower movement and you want to run the room, it's kind of like lean into it and maybe like, and be able, maybe you need to cry, maybe you need to yell, like to get that out. And I think there's a lot of things we bottle up and don't let out. And then it's, it's stuck in our body.
Yeah. I was hoping that maybe you could spend a little more time talking about EMF actually, because I think that's something that we don't talk enough about, how that impacts health and especially fertility. I know in this area, there's been a big push to try to get the 5G towers up.
Yeah.
And, it's concerning. I don't think a lot of people maybe understand how it's impacting our health. Can you go into that a little bit more?
Yeah, I just did a couple episodes that one went live as we're recording this last week, beginning of May, the podcast talking about EMF exposure and how it impacts both male and female fertility. Also a whole host of other things with cardiovascular and carcinogen, but basically the tablets, the cell phones, the Wi-Fi, your laptops it's electromagnetic frequency, so it's exposed. It's harming our body and the reproductive side of things. There's a 6 times increase in miscarriage. It impairs testosterone. It impacts sperm count, sperm motility, DNA fragmentation, early puberty in children. It's really, and it's quite easy to protect ourselves, even though it may not seem like it's easy, but there's a lot, because we're exposed to so much of it, but really to do not, it's interesting, after I did the podcast episode with them, I'm like, why do we put the cell phone to our head? And I wouldn't do it a lot, but now I will never do it again. Because basically that radiation is going right into our brain. Right. So making sure at the very least, when you have your cell phone, to put it on speaker mode all the time. And do not put for men, it's typically men that are putting their cell phone in their pocket, and then that's impacting the health of their sperm. So taking the cell phone out of the pocket, and there's companies such as Defender Shield, which I like. They offer cell phone protective cases. Then also here we are with our laptop. It sits on our lap. And that's then, right over our uterus and our reproductive organs. So making sure if it's on your lap that you have a protective. There's cases, and also just little. I have a couple of them, just little boards that protect EMF by, as I say, from Defender Shield, and also HARA pad, HARA pad, 99.9%. So, and then Wi-Fi, making sure you're about 10 feet away from Wi-Fi. So have it in a closet in your house away from you. And then the cell phone towers, you need to be, I think it's 750 feet away from a cell phone tower. But yeah, with the 5G rollout coming in, it's just to make sure that and there's people that are like hypersensitive to EMFs.
Right.
It's like 20% of the population that, like ringing in their ears. They just, when they are near EMFs, they just feel it, which some are saying those are the canary in the coal mine, giving a flag to the rest of us that don't notice it. But yeah, there's things to do to protect yourself. I think it is awareness, and that this stuff does impact female and male fertility. And just do not charge your phone beside your ear at night. Like at the very least, put it on flight mode, or just charge it outside of the room.
Yeah. Yeah. And I've always been like an advocate for people like that will use their phones for their alarm clock. So they would have it like on their nightstand right next to them, to like minimally 6 feet away. But I think I even like it better, to your point, if they can put it in another room. I mean, I know when it goes off, that means they're not hitting snooze, right? They have to get out of bed to get their phone. But the whole point is like, it really, you really don't want that right next to your head while you're sleeping. And I think I've even seen, it impacts sleep, but it also can create like weird dreams, nightmares. Like it's the quality, even if you're sleeping through the night, the quality of your sleep is impaired.
That's right. That's right. Yeah.
Wow. Thank you for sharing all of that. It's really, I think, important for people to recognize and have that awareness. And it's funny, I don't ever sleep with my phone in my room, but I think the past couple of nights I had my laptop on my nightstand, and I'm like, oh, I got to get that out of the room too. Like I don't need to have that sleeping next to me, right?
Yeah, it's funny when you start knowing that, you start learning this stuff, you're like, oh my, because I used to sit for like, I don't know, I'd sit sometimes and just work with my laptop on my lap for like hours. Right. And then but then you feel that burning, and that's right. Like burning into your skin. There's like a term for that heat sensitive, like people get burns on their lap. Right. But they actually have a shield they have a blanket you can use. So if you're even on an airplane too, use an EMF blanket. I just interviewed a fellow for my podcast yesterday. He has EMF protecting underwear. It's called Get Lambs. And so basically he developed a technology from NASA, and it protects 99.9% from EMFs. He has underwear. He has for men. He's coming out with a line for underwear for women. There's beanies. There's t-shirts, and it's just to be able to protect yourself, because as the rollout for 5G is even stronger, and all the satellites that are in orbit, and yeah.
I'm sorry, can you say what that brand was again?
It's called Get Lambs, LAMBS.com, and they have underwear for men and underwear for a female line.
Get Lambs, like GET Lambs?
Yes.
Baby sheep?
LAMBS, yeah.
Cool.
Yeah. So a lot of the biohackers are using that, and athletes that want to increase performance, because it's impairing your testosterone. So wearing these, he did have an anecdotal story about one of the guys that started with him. He tested his sperm count before he wore the underwear, or the lamb's underwear, and his sperm count was I'm not sure what it was at, but anyways, after he wore it and then he tested it 3 months later, his sperm count had doubled after wearing the EMF underwear. So,
oh my God.
Yeah.
Huh. Well, I believe it. I think, I've been telling men in my office for years to not sit on their wallet, because it throws out their pelvic and low back alignment, and how it's just horrible. So a lot of guys will put their wallet in their front pocket, but then to your point, but you don't want your phone in your front pocket either, especially because it could be sitting there for hours, exposing that really sensitive tissue. So yeah, this is really, really, I think, important and it's like, this is like a daily thing, right? It's not like, oh, I only carry my phone, once a month, right? Like people have phones on them all the time.
All day long in their back pocket. Yeah. Or in the front pocket right near their reproductive organs.
Yeah. Yeah. So important to be aware of. So this has been really enlightening and eye-opening, Sarah. I'm really so grateful for you to come on today. Do you have any last bits of wisdom you want to share with the audience?
Yeah, I just think it's really important to listen to your body. So your body will whisper to you. It's the quote, I think it's from Mark Hyman, I'm not sure, or maybe it's Dr. Oz, but yeah, your body will whisper to you when you ignore the signals. It'll start shouting at you in the form of disease. So people that I'm working with, they're dealing with infertility, and it really is to listen to your own body. You know your body best, and really start tapping into your intuition, and doing what feels right for you. And if you're feeling like in a panic or impatience or that side of things, that kind of takes you off track. So really come back to listening to your body and making those choices that feel right for you and your partner.
Well said. Well, thanks again for coming on, and I'm so grateful for your time.
Thanks so much for having me, Laura.